Good morning, namaskar, and welcome to Apollo 24/7's Health Hour. And today we're going to talk about how to delay aging. It's not just one expert today, we are bringing you two experts. We are bringing you a very senior dermatologist, Dr. Radha Shah, and also clinical dietitian with a lot of experience, Dr. Priyanka Rohatgi, to the live show. Please ask your questions about aging, your skin, your diet, and how to delay aging on YouTube of Apollo 24/7. And before we start, let me introduce you to Apollo 24/7 app. Download the app and get all the benefits. Let's see how it will help you.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in three important ways. One, listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. Two, advise. We'll give you expert advice you can rely on because it comes from India's #1 healthcare provider. Three, assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
So this is Apollo 24/7's Health Hour. Every Sunday, we bring experts from Apollo hospitals into this live show where you can ask your queries and questions about the topic of the day. And today we're going to talk about how to delay aging. See, age is a number, you cannot avoid it. You have to age, but how to delay the signs of aging and look bright, fresh and young. And I'm going to introduce you two experts today. We're going to have an unbeatable combination of a dermatologist and a clinical dietitian. The first specialist that I'm going to introduce you today is Dr. Radha Shah, who's a dermatologist from Apollo Health City, Jubilee Hills, Hyderabad. She has more than 26 years of experience and she's a professional member of Indian Association of Dermatologists, venereologists and leprologists, so is a life member in leprologists as well, Cosmetic Society of India's life member. She specializes in dermatology, dermatosurgery, lasers and cosmetology. Her achievements and awards are Best RMO Award, National Conference Awards for paper presentations, and she's been doing online webinars for dermatologists and won many awards there. She's done a lot of research and has authored papers. She's co-authored, co-edited textbook of dermatosurgery and cosmetology, multiple papers in medical journals. Her research involves in multiple clinical trials in psoriasis, acne vulgaris, and dermal fillers and hair fall. Here we have Dr. Radha Shah. Good morning, ma'am, and welcome to the show.
Thank you. Good morning to you too.
Thank you so much, ma'am. It will be a pleasure. And also joining us today it's a double bonanza. We have a clinical dietitian with 20 years of experience, Dr. Priyanka Rohatgi, joining us today on the live show. Good morning, ma'am, and welcome. And let me quickly talk about Dr. Good morning, ma'am. She has more than 20 years of experience. She is the chief clinical dietitian and head of Apollo Hospitals, Bangalore. And she's the president of IDA Bangalore chapter, elected NEC IDA, online member of NEC IDA, and her awards and achievements involve weight management program faculty, nutrition quotient, and IDA. She has 8 gold medals. Wow, ma'am, wonderful. And awarded an international award from UK. Her research and papers are quite interesting. She's contributed articles in press and print, national international publications in scientific journals related to nutrition. Good morning, Dr. Priyanka, and welcome to the show.
Good morning. Thanks for
So,
having me here.
thank you, ma'am. So it's going to be a beautiful frame today, and we are going to talk about our youthful appearance and delaying aging. Dr. Radha, I would want to begin with you. Age is
Yeah.
something that I cannot stop. Age is something that I'll have to accept gracefully, and physically I might go down. But I'm sure nobody of our viewers who have joined us live today would want to look aged. So we would want to understand what is the. I understand that skin is the first one which will show signs of aging, and how and what are the signs that can be called as aging.
So skin is the only organ which shows aging because you cannot see any other organ of the body. Skin, hair, and nails. So skin basically what
Yes.
happens is as you start growing older, the skin starts going dry, rough, wrinkled. Some people they start sagging of the skin. The folds start appearing depending on your different actions which you do on the face. The folds come in prominent folds, and then of course you can get red lines if a person is having a very fair skin with freckles and exposed to a lot of sun in his youth years. Then he starts getting the red lines and different kinds of little growths which might be benign, which might be malignant. All that can be seen on the skin, and it is not just skin of the face, also of the back of the hands and of the feet. These are the three sites which are maximum exposed to the sun. So we look at these sites all over for seeing for aging of the skin. And hair, as we all know, we get the premature graying. So if anyone as a child gets graying of the hair, it's premature. So it's a part of growing old, considered as a part of growing old, and the receding of the hairline and hair fall. And the nails, what we
Yes.
start seeing is brittle nails, dry nails. You start seeing long ridges. You get rough, bumpy nails. So different changes we see as part of aging of the skin.
So you mean to say that aging is a normal process, but there are causes that can speed an aging or look weathered, and sun is the major factor, is what I understand.
Yes. Yes.
Yes.
Skin is
Okay,
sun
so
is definitely
yes,
major.
please continue.
Yeah. No, sorry.
So,
Sun is the major factor. But other factors also contribute depending on what is your environment, your especially on the face is how much you exercise your facial muscles, the expressions you do. Those are the people who age more, who are more expressive in their look, who use a lot of products on the face. So those things will also aggravate.
done. So coming to Dr. Priyanka, I understand that food is what that keeps us going. It's a fuel for us, but there must be definitely a connection between certain good food and nutritious food and looking good. Can you please explain that?
Skin is directly a reflection of your health and your healthy eating. And healthy
Yes.
eating is not just the food, it's the entire lifestyle around it. So, the discipline of sleep, the hydration, the use of synthetic ingredients. It could be in the food, it could be on the skin. So, everything impacts. And, we fasten it by having junk food, which is rich in high fat, salt, and sugar because that tends to age the sugar by increasing the lines on it.
So, if sun is the external factor that can damage, sugar and salt are the internal factors that can damage further.
And then you have the antioxidants which are loaded in your fruits and vegetables that can protect against the UV rays and the destruction.
Oh, that's interesting. So, we should actually talk more about the antioxidant rich food and what is directly available. So, Dr. Radha, while you were introducing us to the factors that can actually speed in aging, you were talking about people who use a lot of products. In fact, on contrary, people think that if they use product on their skin, they're going to look good and it's going to benefit them. So, what are these products that can harm skin and then further speed in the process of aging?
So it's not just the product alone, it's the frequency with which you use. And if they are drying, you have a very oily skin, you're doing drying products, but you're doing it for multiple times, like you're washing your face 8 to 10 times a day, whereas 2 to 3 times could be enough. So that is also causing dryness of the skin. And dry skin, we always see more, the wrinkles more frequently. Many times, young girls who have active pimples, but still they will have wrinkling seen around the mouth. So that is because the products which are being used are wrong. So you don't use very harsh chemicals. Then the procedures which are being done, because there's a big fad to keep going to the parlor and getting procedures done. So unnecessary use of those products or frequency. It's what frequency. You cannot look perfect all the time. You have to allow your skin to heal. So too much products, and the wrong products, depending on your skin type, can definitely stimulate the process of aging on your skin, on the person's skin.
Right. So, on the contrary, that people think that they are going to salons or getting on over the counter cosmetics to protect their skin, we are doing damage. So, let me understand what are these harsh chemicals. आजकल तो every product that you see, I will find one hyaluronic acid or ahas and alas based food. So
DH.
talking about skin. So how good are these and what age? Retinols, collagens, everything is out there on everything. Are these going to help us in any way, Dr. Radha?
Yes, they will help you provided you use it in the correct percentage and in the correct frequency. Certain products, like you mentioned, AHAs, retinoids, they should not be used in the daytime. But people are still using it because they bought it over the counter. They don't have a proper advice on how to use it. Instead, they are not focusing on the sunscreen. Sunscreen is something we all need, irrespective of whether we go out or we are staying indoors. But people will compromise on that. They will go to products for instant appearance. That doesn't work out. So you have to use the right products, right method of using, time of using it, and definitely they work out well. Problem is there's a lot of this online sales of products, and people think you buy it, you're getting at a cheaper cost, it will make you look good. So you must have a proper dermatologist advice on how to use products, and definitely you can use them for years to come.
Yes, ma'am. So, Dr. Priyanka, one of these, at US से जो वापस आए हैं, one of my young friend's younger daughter, she started using collagen into those sachets, put it in water and drink. She's hardly 19, 18 and 19. And she thinks that she's aging very fast and she started to take supplements. And I was like shocked to see young girls, and this is all over the counter. So, do these help? Are these supplements in the name of all these vitamin C and D and zinc added to your food? Will these help good skin?
See, first of all, you need to understand if there's a nutrition gap existing. If somewhere you're not eating right, because excess of a nutrient also can be damaging. We were talking about beta carotenes and retinols, these are all fat solubles. So, we don't want them to accumulate in excess and cause toxicity. So, you must always do it under advice. Now, coming to collagen, the first part of the question, our skin has adequate collagen, and as we age, that's when we need the correction. And if you are good at your protein intake, good at your exercise, the muscle toning happens well, the skin is breathing well, so you really don't need local application of collagen at this age of 19 years. Yeah, if somebody has undergone a procedure where there's drastic weight loss and the skin is sagging, that's when, under medical supervision, you would be advised to take certain supplements.
Yes. So what age, may I understand from Dr. Radha, what age is normal to say that we are experiencing signs of aging? Is it 30s? Is it
Yeah. So basically, it is the end of 20s. It can start as well as end of 20s or early 30s. So we have to look in each person, it could be individual. So it depends on his environment, on his use of products, his skincare routines. That makes a difference on what age it starts. But towards end of 20s or early 30s, we have to start looking out for signs of aging.
And if I can add to it, see, what really happens is the exposure of chemicals. Now, if you've been on a diet which has a lot of preservatives and packaged food items, additives, that really adds up to the aging of the skin. A simple example is of glycation. So, when we take a lot of sugar or packaged fruit juices or any of those preserved food items right from the packet, they contain a lot of salt containing preservatives which are rich in sodium. that holds a lot of water and then releases the water, so you have puffiness and your skin is getting really bad repercussions of that. Similarly with sugar, your skin gets into glycation, and this glycation can really age your skin much much faster. So the best thing is stay natural. My mantra to you would be eat things grown on a plant rather than manufactured in a plant. So that way we can keep our natural goodness intact. Wherever possible, cut down the elements of sugar and salt in excess, because that is something which is damaging the skin to a great extent. Take a lot of fluids, because the more hydration, the better your skin is able to release all these toxins out regularly. Sleep allows you to hydrate, absorb well, and rejuvenate much much better. So these are few disciplines in life, if we follow, we can definitely get the goodness of our genes to the great extent.
True. That is true. It's a holistic approach to the whole issue.
Right. And talking about specific nutrients, we have a lot of vitamins and minerals. You may get jargons of name which people extract and market their product. A simple thing like a grapefruit fruit extract. Now grapes we know are good for health. They have something called resveratrol. People market a tablet or a drink in the name of resveratrol. Why do you really need it in the synthetic form when you can actually eat your natural fruits and vegetables as such? Or coming back to lutein or lycopene, so these are jargons which are interesting, and we really want to understand more. But these are all coming from your natural fruits and vegetables like tomatoes, your green tea, your regular herbs that you use in the kitchen. So the first pharmacy is your kitchen, rather than reaching out to a pharmacy and picking up products without supervision. So always talk to your healthcare professional before you pick up any supplement and expose it to yourself.
As a part of prescription, diet is a very important factor. Diet, the products they use, everything makes, it's not just the product that I would prescribe. It's not that, the regular daily things. And diet has a major role, especially on skin, hair and nails, everything it affects. That should be looked into. Patient has to understand that. Without that, you can't look good or maintain your youth for long. It starts showing through.
Yeah, and these days we have a lot of UV exposure due to the gadgets that we are using. So,
Screens.
that's why I think sunscreen plays a very important role in protecting the skin from these ultraviolet radiations coming from LED lights or the screens that we are using these days.
Yeah. Even the
Also about,
lifestyles, no?
yeah,
No, the
also
lifestyles,
we,
people going for swimming, going for outdoor activities without using sunscreen, and then coming back and then noticing the damage. So the damage has already set in. And as we say, it's basically sun damage is a cumulative damage, something which happens over a period of years. It starts right from our early school days and college days when we are getting the sun exposure, and then it starts showing through in the older age group. So it's not that I didn't have sun exposure recently, it is that you had it all throughout. Now your skin is showing through. It's not able to repair itself. That-
Sorry, ma'am, there was a technical difficulty from my end. My power just got interrupted. Thank you for bearing with me. And I missed something important, but I was catching you up on the YouTube. Well, so let me also join in understanding sun exposure ke bare mein Dr. Radha Shah was trying to give us. So there
That's
are
what I'll
men who think, yeah, men think that they don't require certain they think that it's only women who age and men don't. But I see a lot of men who are also concerned with how they look. Aging is also something that concerns men a lot. So sunscreen उनके लिए भी है क्या? The sun damage, they are more exposed, is what I think.
Sunscreen, sunscreen is for all age groups, right? Starting right from childhood, right from the school years. Sunscreen usage has to be made compulsory. Patients need to understand what to use sunscreen. The type of sunscreen may change. Something for an oily skin, something for a dry skin, depending on how they're having it. Not throughout as they grow older. Sunscreen is compulsory all age groups. Only thing they brand it as differently for children and adults. It's nothing like that. The composition is the same. Everyone can use the same sunscreen, but it should be used. That is important and daily basis.
Yeah, yeah. And nutritionally, Dr. Priyanka, is there a difference that all genders or ages need to change according to their age groups and their genders? Is the nutrition requirement same?
It wouldn't be same because children have a lesser surface area, so their requirement is lesser. So we have this Indian recommended dietary allowances, which gives us a ballpark figure as to how we have to focus on our nutritional requirements. We generally in our practice see the problem when people want to go on a weight loss diet, or they are trying to make some lifestyle modification. They drastically cut down their meals, or they switch to some fat diets like a no carbohydrate diet or a no fat diet. That's where we
Or a high
find the
protein
difficulty.
diet?
Yeah, exactly, the extremely high protein diet. So they miss out on a lot of these essential vitamins and minerals which can really age them much much faster, and they start looking sick after the weight loss. So
Yes,
any
yes.
drastic change is something we don't have to fall guinea pigs to our own health.
Yes. Dr. Radha, here's Bharat, who is interestingly, there was one point which he noted on YouTube. Bharat is asking, why isn't stress mentioned yet? Drugs, alcohol, are these not the cause of early aging?
Yes, they will also contribute. Lifestyle changes, stress will definitely contribute to it. And it's not just the stress, it's how you handle the stress. So, if you're into a regular exercise routine, you're eating well, that also helps you to fight the stress. That is important.
Yes.
And definitely smoking alcohol. There are a lot of factors. If we start enumerating, sometimes we skip telling it, but definitely smoking and alcohol, or with smoking is more the culprit, which will promote your aging process.
Right, right. So, Dr. Priyanka, definitely you also must be agreeing to it. And what kind of damage does wrong eating, wrong time, wrong foods, along with stress and alcohol, tobacco, what do these do to us? You were talking about antioxidant rich foods, while these are all directly oxidating us.
Exactly. So when you have a smoke or when you are sitting for more than 2 hours, it's as good as taking a cigarette. We don't realize that. We sit throughout the day, right? So that releases a lot of free radicals, which are nothing but oxides for the body. And they tend to really make a lot of difference to your beautiful skin. The glow goes off, the circulation becomes bad, and you start seeing these fine lines becoming more prominent.
Yes, yes. So, also understanding that the antioxidant rich diet, what is this, and what are the food groups that one should take to understand more about? It's not just plain well being, it's also concentrating on good nutrition.
See, if I could summarize the whole concept of a good diet for skin into a mantra, that becomes easy to remember. So let's start with 10, 8, 6, 5, 4, 3, 2, 1, where 10 stands for 10 glasses of water. Now, we have to make sure that this water is unsweetened. So many times we find people taking a break and having a cold coffee or a sugar loaded fruit juice, or some concentrate diluted in water. So you don't need that. All you need is maybe a natural water, infused water, or a regular concoction that you make at home, which is from your own kitchen, which just has natural fruits and vegetables. So 10 stands for that. 8 stands for 6 to 8 hours of sleep. This is very, very, very important, and in the right biological cycle in the circadian rhythm of 10 p.m. to 6 a.m. When we miss out on that, we are countering a lot of factors in our body, because our body releases cortisol between 6 a.m. to 8 a.m. That is a fat forming hormone. So that time we need to be active and alert and doing our physical activity. So 8 here is 6 to 8 hours of good sleep between 10 p.m. to 6 a.m. So don't sit with your gadgets in your bed and uh, let your sleep get affected. You also get charged with sleep. Let them also get charged in another room, not next to your head. Then 6 stands for 6 meals. Break up your meals into 3 major meals and 3 smaller meals, whereby smaller meals are not biscuits, chips, or wafers or chocolates. These are fruits and vegetables. So 3 main meals and 3 snacks consisting of not a cooked meal again. It could just be your nuts, it could be your fruits, it could be your vegetables. Simple example could be cucumber carrot sticks, or you could have your cucumber infused water, you could have your lime shots, any of those naturally done, not from the bottle or from the packet. Five stands for five or more servings of fruits and vegetables every day. That's very, very simple, and that will take care of all your antioxidants, vitamins, and minerals. All the jargons that you read on the internet, like lycopene, lutein, beta carotene, and nice fancy names, these are all pigments which come from your fruits and vegetables. Just focus on eating five servings of fruits and vegetables, and there you are. Now, 4 stands for ensuring that you have at least a break of 4 minutes between every 1 hour that you are sitting. So just get up, move around your table on your workplace or at home or wherever you are so that you don't sit for very, very long. 1 hour is the limit. After 1 hour, you have to stretch or do some movement and stay active. 3 stands for ensuring that you have a good intake in the 3 meals that we are eating. So, those 3 meals have to have proteins, fruits and vegetables, your dairy products. And some people go on off dairy due to various reasons. Find a
Yes.
scientific reason before you make any drastic changes. Take a consult from your healthcare professional. Only then make drastic changes in your lifestyle of going either wheat free or milk free or whatever. 2 stands for 2 hours or less of screen time. Now screen time is something we may have due to our office work, but leisurely screen time should be less than 2 hours. 1 hour stands for 1 hour of good physical activity. We are not blessed with the old lifestyle where everything was done by hand and on foot. We are so mechanized in our approach, so we need to take that time out, especially after our 30 years approaching. The moment we are 30 plus, a discipline of some exercise done on a daily basis for 1 hour. And zero stands for zero junk food on daily basis. Once in a while, a cheat day is okay, but not daily.
Yeah.
Was
Okay,
that a lot of
wonderful, ma'am.
information?
So we just have 10 to 1 wonderfully put together. Thank you, Dr. Priyanka. Well, Dr. Radha, one quick question before I start taking the questions on YouTube where people are asking you questions. But one quick question, hair. We've been talking about skin. You did mention that receding hairline is also one concern of aging. So, how is it skin related and how is it food related or age related? The hair fall, I
No,
mean to say.
as Yeah, so as the aging occurs means the cells start diminishing in their activity, the regrowth process. That's how the hair thinning starts as you grow older. Another part is the graying of the hair. So the cells don't produce the pigment any longer. The pigment which makes our hair black or brown or whatever the shade is, that pigment production goes down. That's why the hair starts graying. So these are the two common changes which are seen. So you start seeing the receding of the hairline, this thinning of the hair thickness as such goes down. You feel that the hair are thin, and those are the changes you see in hair. Because in general, the activity of the cells goes down as we grow older. Multiplication of
Yes.
the cells, hair root
Okay.
cells.
Huh. So, Banot Narendra Kaur, दाढ़ी पे बाल आ रहे हैं, hair on chin. So this is something which concerns women a lot, hair on chin. So this is also considered after certain age. I think this comes, ma'am. What's the reason for facial hair on women, ma'am?
So phase it'll depend on the age in which it starts. So if it's in a younger woman, they are different. It's the hormonal imbalance. If it's an elderly, like around 45 plus and all, it's the menopausal changes which give rise to again a hormonal imbalance and the hair on the chin starts thickening. So you have to get it checked if there's any hormonal imbalance, have it corrected. Otherwise, the lasers have to be considered for hair reduction.
Okay. So I'll come back to the question on lasers a little while later, Dr. Radha, because I think a lot of people will be interested to know about it. Dr. Priyanka, here's a question for you. Budget by 123. They've not given me the age or gender, but what type of exercise and diet for working women do you advise to prevent aging after pregnancy?
Okay, so since it's related to pregnancy, I assume it is around late 20s and 30s and thereon. So
Yes.
women need to realize that we are more fat percentage rich compared to men. So if we do the body composition, women have higher fat percentage. So after the age of 30, we need to focus on strength training. Now, strength training could be you hold your muscle and provide a resistance so that the muscle is able to strengthen itself. Remember our
Yes.
old school PP exercises where we used to stretch our hands and oscillate them for a count of 10 or 15? Simple exercises like those done for each area, upper body, abdomen, chest, thighs, would be really really good, because when you do muscle strengthening, you do not encounter problems of sarcopenia, which is muscle weakening. And then you can prevent a lot of non communicable diseases. So pregnancy, where
Yes.
the body gets out of shape because there is a growth which is happening, to bring back the muscles back to its tone, good strengthening and muscle straining exercises would be good.
Wonderful. So, Dr. Radha, here's a question for you. Shravan Raj is asking this question. I want to ask you about how to take care of skin issues after suffering from multiple health issues back to back. Due to weakness, it reflects on skin and hair also. Yes, if somebody is recovering from illness, I think skin is the first one to take the brunt of it, no ma'am? How does one
Correct.
recover?
Because there's a lot of nutritional loss, and if again diet is not proper, they're not able to eat properly, then the skin shows. That's why I said skin basically reflects quickly because we can't see the other organs of the body. So in such a case, diet is the most important thing, as Dr. Priyanka has told. They have to focus on how to eat, what they are eating, and they'll need vitamin supplements also to help them get back. And if it is any specific illness, that has to be brought under control. And of course, basic cleansing products, use of moisturizers regularly. And if there's obvious wrinkling or thing has set in, then they need to take some products for which they can meet a dermatologist. They can be guided accordingly. But nutrition would play the maximum role in such a patient.
Yes, ma'am. Would you want to add something, Dr. Priyanka?
Also, our cooking methods, because if we are cooking in a wrong way, like most of the people are doing a lot of barbecuing and things like that, that releases a lot of glycation end products, which is very bad for skin. So, high temperature, prolonged cooking is something that we should prevent. The healthiest way to get the nature's goodness is steaming or, sauteing our preparations without exposing them to very high temperatures.
That's an important and valid point. Thank you so much for sharing it, Dr. Priyanka. Dr. Radha, here's a question for you. Deepika Jain, 42-year-old female. Can treatments like HIFU help delay aging, and should one consume collagen supplements?
HIFU is one of the newer treatments for delaying aging, basically again wrinkle management and skin tightening purposes. Can be used if it is done way, definitely you get the results. But one thing we understand about aging is it's an ongoing process. So even if I'm taking a particular treatment today and I feel good and my skin is rectified, over a period of 6 months to a year, again the issue can come back. So you need the maintenance therapy in between, which may be maintenance healing sessions or maintenance creams as per the case. Coming to collagen, collagen is something which is coming new for skin glow and the what you say the skin folds, sagging of the skin. So this is a product which is used. I personally don't advise too much of it, but it can be tried. I don't think, because collagen, according to me, is a product which doesn't really directly get absorbed. It's a large molecule, so it's not going to be. It has to be broken down. It will be broken down into amino acids and absorbed. So its efficacy needs to be seen in the long run for skin. Again, collagen containing products which are available, moisturizers and others. They also, how much they get absorbed is a little variable thing because the size is a little big. But yeah, it's available. I personally don't believe a lot in collagen things for skin aging.
And naturally, if your food intake is rich from good pulses and legumes, you get natural collagen as well. So
I
focus
don't
on
think.
first enriching naturally and then adding on to it. And also,
Yes.
the common mistake that we do is we eat a lot of protein, we go by some blogs or something without reliable information and start pumping in a lot of protein into our body without the proper exercise, without even understanding whether our kidney can hold it or not. So, don't make any drastic changes in your diet pertaining to any macro or micronutrients. Always have a basis and an understanding as to why you have to make that change. uh,
I think our
is
traditional foods are the best foods which have been there for years. But people are adopting a lot of new products. You must be dealing with them more. So I don't think they have really have an advantage over the traditional foods. So that should be more focused on the diet and the frequency, as you explained, that 10 to 1 thing. I think that was a very interesting thing. I also try to remember. We all are little lax in certain aspects. We need to strengthen up.
Yes. Ma'am, can you hear me? I think the power cut and the fluctuations, but I hope you can hear me well now. The next question is about lasers, Dr. Radha Shah. Are lasers effective for skin? How good are the lasers?
I didn't get your question, Nancy.
Yes, ma'am. I'm
How
quickly
good are the
asking you the
lasers?
lasers.
Lasers for what?
Lasers for uh, that's the only question that I saw, ma'am. We've been
Okay.
talking about
In
yes, ma'am.
general.
Healing
So
scars. I'm
lasers
sorry, ma'am. Abhishek Sodi, 23-year-old male. I want to know if lasers can really help in healing scars completely.
See, completely no one will give you a guarantee as such, but definitely they help in reducing your scars. And depending on what laser you're using, whether it's a simple, erbium YAG laser or it's a carbon dioxide laser, the results can vary. So the best laser for scar removal is a carbon dioxide laser, and definitely helps after few sessions. But you need a repeat sessions, and you can achieve easily 80 to 90% correction in the right hands.
So, ma'am, this again, we would want to, I would want to let the audience know that this should be consulted, taken in advice, who's especially a dermatologist trained in doing these, because we've heard so many cases of lasers burning skins and other side effects. Anything that you want to add
Yes.
here, ma'am?
Yes, and it should be, yes, correct. Definitely, a lot of side effects are there, and also post procedure care is important. It is not just getting the procedure done. The person has to understand he needs strict sun protection and certain medications for a time period of time after the procedure. Then only the maximum benefit can be attained. Otherwise, we land up in unnecessary complications, and patient is not satisfied that the result has not come through. Everything has to be followed. It's not just the procedure.
Yes. Dr. Priyanka, here's a lot of interest on alkaline water or what kind of water to be taken. Himanshu Narayan Prasad and Kete Palli Ravi Shankar, both of them are asking similar questions. Uh, Alkaline RO water, is it good for health? Ravi Shankar is asking, I've checked the quality of drinking water in my house after passing through RO. It shows TDS and will it have some effect on health? Ravi Shankar, male, 60-year-old.
Okay. So, nice, interesting questions. Number one, we don't really depend on water for its alkaline or acidic impact. Our stomach has a very high acidic pH. So, water would not really make a major difference. Yes, if you have acidity issues, water is not the solution. The solution is correcting your diet, the timings of the diet, the spice content, the stress that is adding to the acid production in your stomach. Now, if you really want to make your water alkaline, which helps in reducing the bloating and gas, what you could do is put all your cucumber, lemon, fruit slices, a little bit of ginger that changes the water into a slightly turbid and alkaline water. So, this is a natural way of doing it rather than buying a special filter for all these purposes. Coming to the second question of TDS, we really should not go for a very low TDS content in water because that brings down our immunity. A little bit of dispersible solvents in the water are acceptable. So your TDS content should not be less than 100 when you test your RO water.
Okay. Right, thank you. Dr. Radha has a question for you. We were talking about sunscreens a little while earlier. So here's a question from Bharat R, who says, are there any other solutions for sunscreen, any natural solution other than using sunscreens?
As of now, there is no natural solution except that you totally avoid sun exposure. You cover yourself nicely with a big broad hat, full sleeved clothes, and sunglasses. Those are the only things you can do for a physical cover. Because some people are allergic to sunscreens. That's why this question is raised, maybe. Otherwise, there are sunscreens which contain only zinc oxide and titanium dioxide, so those won't react. They can be used in people who are allergic to sunscreens as such. But there is no natural product that you can apply and protect yourself from sun. Antioxidants, again, as it is mentioned in diet, they do have a sun protective action, but no substitute for
Yeah.
sunscreens.
Right. So Bharat's question in continuation was anything that we apply skin is absorbed by the body. So aren't the chemicals in the sunscreen absorbed in the body and won't they cause cancer?
No, the sunscreen molecules which are being used today have been studied over a period of years. And there were some molecules earlier which caused cancer, but they are not available in the sunscreens which are available in the market today. So they are pretty safe. Pretty safe.
Wonderful. Thank you for that assurance because I endorse using sunscreen and I continuously use sunscreen even I'm at home, even if I'm not working on a day-to-day basis. Also, I do. Thank you so much for giving that assurance, Dr. Radha. So, Dr. Priyanka, you earlier were suggesting that to an extent, antioxidants can help in UV damage. How does that help, ma'am?
See, when you absorb UV rays from the sun directly to a skin which is exposed, which does not have a sun block coverage, your sunscreen has not been applied. So that penetrates into the skin and makes the damage happen. The free radicals are formed, which form the oxides in the body and they are damaging to the cells. So then you see eruptions on your skin, you see, bad surface, the texture of the skin is not nice and glowing. Now, this was the local application of a protective layer. From the food, what antioxidants we eat are your vitamins like vitamin C, vitamin D, vitamin E, and vitamin A. In the minerals, also, there are certain categories like your zinc and the others, which provide a protection to these oxidation which is happening in the body, and they allow your skin to have the natural glowing goodness, which prevents a lot of damage that can happen.
Wonderful. Thank you so much, ma'am. Here's a registered user's question to Dr. Radha. Dry skin patches about a palm size under the arms. What might be the reason and what should I do to prevent it? Age and gender mention नहीं किया है यहाँ पर.
So if it's under the arms, it could also be allergies to if they are using antiperspirants or perfumes. That has to be looked into. Or it could be dry skin patches also if someone is atopic, someone suffering from atopic dermatitis. Or it could be other skin rashes. You need to basically consult a dermatologist. The type of rash will give a clue on what it is. But commonly it could be the sprays which are used there. So definitely that has to be
Yes,
seen.
yes.
I can't answer this question right away without having a look.
Exactly, ma'am. And, and you raise an important point. We think that perfumes make us feel. The advertisements lure you to use all these sprays and antiperspirants, etc. So these are the most worrisome causes. If somebody is worried about cancer or any other harsh chemicals from products, I think this should be more worried about. What would you say, Dr. Radha?
Yes, yes. There are a lot of products which you use routinely without even thinking about its cancer potential. But when we say use a particular product, then people are bothered about its cancer potential. So that we should not look at. See, most of the products which are there in the market are always out after years of research. So they mostly don't have a cancer
Yes.
potential.
Thank you, ma'am.
That is
Yeah, Dr. Priyanka, is a question for you. As you were talking about lycopene and other elements, Ayapan D is asking this question. What are the lycopene-rich fruits and vegetables?
So most of our traffic light colors like the red, orange and green, which makes it very easy to understand. The red color has most of the
Simple way.
lycopene content. Simple way, yeah. So red color has a lot of lycopene. So you have it in your watermelon, in your beetroot, in your tomatoes, and the more you cook it, the higher is the bioavailability in the body. So watermelon is something we don't cook, but we can just eat it off as a fruit. And tomatoes are something we add in our vegetables. So if we use a lot of tomatoes in our gravies, or we use tomato also has the goodness of vitamin C. A local application on the skin also can be very good for removing the scars and things like that. So lycopene is very good, and you don't really have to get carried away by these jargons mentioned on the products. These are all simple pigments which come from your natural fruits and vegetables. Don't get carried away and don't pay a big price for it.
That's interesting. Thank you. Dr. Radha, Pankaj Kumar, age 29, gender male, My beard has been white, and what should I do?
I assume he's talking about the gray hair, or is he talking of whiteness of the skin? That I can't get. Gray
No, I
hair and
think,
20,
oh, gray,
yeah,
gray
praying
beard.
29-year-old, then definitely he needs to work on his diet. Second could also be genetic reasons, like if there's a family history of premature graying, that could contribute. And coming from the drugs point of view, basically the only drug which is known to work help in this is calcium pantothenate. So he can take supplements of that drug, but it is for a few months. So he needs to work on his diet, because if you're having one vitamin B deficiency, you will be having deficiency of the other vitamins also. It's just that it's probably not manifest right now. So take a general multivitamin
Yeah,
and pantothenate as such.
yeah. Would you want to add something here, Dr.
See, what I've generally seen is when patients come to a hospital, they say, "Iska koi side effect to nahi hai, iska koi side effect to nahi hai." They go to a parlor, they apply all kinds of colors, global coloring. These are all heat treatments. On their skin, they want all kinds of heat treatments. They are not really worried about that. We know that any kind of heat can cause a lot of damage to the skin, to the body, to the hair. And you are really bothered about the side effects coming from the natural supplements that the healthcare professional is advising. So please think twice before you use anything on yourself, be it a local application or a tablet or a powder that you're consuming. And be a well informed consumer. Read all the ingredients or the label carefully so that you know what are the additives added, what are the preservatives added, is it really needed for my body, am I overdoing it, is it above my recommended dietary allowance. That's where you would strike the balance. And this we don't commonly see. We don't see patients coming and telling us that I buy samosas and I don't really know how many times the oil has been used in deep frying. So you really know it is so rich in the oxide content of the fatty acid oxidation, and you want to know the side effect of a good thing that is advised to you. So be an informed consumer and take those informed choices for yourself, for your health.
It's also about trusting the physician. You need to trust the physician that what product is advised would be helpful to you. It's not going to give you further issues later on in life. But the trust is important. That is important. And as you said, parlors and all, yes, they'll do everything and come. But here, if we'll advise them on simple peels, we have to convince them 10 times that it's going to be safe for them. The attitude of the patient has to change. People in general, I wouldn't call them patient, I would rather call consumers or clients or whatever. That attitude has to change, that what is being advised is for your benefit.
I can see an interesting question in the chat which talks about use of the material of the pillow. Dr. Radha, is there any significant answer to that, whether cotton, silk, or what kind of?
That basically depends if someone is having dry skin issues or atopic dermatitis, then insist on cotton pillows. But otherwise, I don't think it in general affects the delay. I mean, affects the aging process or gives you skin issues. It's only if you have a sensitive skin, atopic skin, then you have to be. We insist on using only cotton stuff.
And also probably the hygiene and washing of the pillow to be done regularly, which is not really something people pay attention to.
Yeah, sometimes that is also the issue. Yes.
Sorry, and I'm back. Sorry for the interruption. Too many times that my power fluctuations at my end. Yeah, ma'am. TS is asking, what are the best anti-aging creams which can be applied on the face, because I'm not using any creams or product. I'm age 42 right now. So, are there anything that really promise anti-aging, Dr. Radha?
Yeah, promise is there, it works also, but it has to be continuously used. But that comes in addition to your basic cleansing routine, use of moisturizer, sunscreen, and aging creams can be done at night. They're different in the markets, more than 1,000 products, different combinations. Most commonly, which we use are glycolic acid, kojic acid, and we have azelaic acid, aloe vera preparations. So different products are there in the vitamin C containing products and retinoids. All of them work depending on your skin type and routine. Then the products can be advised and they have to be used lifelong. That has to be understood.
Yes, Dr. Radha, the question for you, it's for you. I have had it. Ichthyosis vulgaris since I was 3 year old. So many medications I've used, but I'm not satisfied. Nobody in our family has this problem. I'm suffering from aging, a lack of moisture of the skin. So what is this, ma'am?
Ichthyosis is basically a very dry skin condition where the skin is super dry, and basically it's a genetic thing. So if she doesn't have anyone in the family affected, it must have been a mutation that she got it, and it will persist throughout life. They have fish-like scales all over the body. So moisturizer has to be intent, and again comes down what is the composition of the moisturizer. So something with urea, lactic acid, glycolic acid, those molecules will help her more. It has to be more frequent applications, usually to be applied on wet skin soon after bath. Then the cleansers that you're using, so you can't use harsh cleansers, it has to be mild cleansers and moisturize more, keep the skin protected, by full sleeve clothing and all, because exposure even to sun radiation and what you say, the air and all those things. Again, she's in an AC environment, she's using the heater for long duration, all that will aggravate it. And vitamin A can help her, oral vitamin A. And again, the diets, foods which contain rich in vitamin A, like your carrots and milk products, all those will also help her in reducing it. But there is no
Yes.
permanent solution to ichthyosis. It's a genetic thing. It will persist throughout things. She can only keep it under check. A daily
Yes.
application, and she's it.
Yeah. Dr. Priyanka, here's a question for you. Aravi Muzat Soni is asking this question. Aravi's question is, I've read an article saying that coffee can reduce aging. What is your view?
Coffee not loaded with a lot of sugar and milk can definitely give you antioxidants, but again, it is diuretic, which means that it takes away the excess fluid from your body. So, when taken in the right quantity, maybe a black coffee once or twice a day is okay, but you should not overdo it.
All right. Thank you, ma'am. Clear cut answer there. Here's another question. Is there any solution for cracked feet? Bharat is asking this question. As you were trying to tell us in the beginning that feet are the ones which can show signs of aging, what are these signs and how can we take care of them?
So aging of the feet again will be basically dry skin. You see the wrinkles coming up quicker. You can see the skin is all wrinkled and rough to touch. Those are the same signs as you see on face, but face you may see it little later because invariably most of us use a moisturizer on the face, but we will not be applying it on the top of our feet. So that's why you see more on the feet. But what he talks about cracked feet is not really aging process. It is excessive dryness of the skin, and for that again the mild soaps to be used, and creams containing urea, glycolic acid, salicylic acid, which will cause peeling of that excess skin. The skin is not able to shed by itself. Daily there's a skin cycle where the top layers of the skin shed off. These people, the skin doesn't shed, it just accumulates and then it cracks out. So those creams with salicylic acid should help him, urea should help him, and vitamin A intake.
Oh, intake. Done. Done.
Yes,
All
yes,
right.
tablets.
Yeah. Dr. Priyanka, I think this question you should be answering. TS, no A name and gender. Query is, I'm a pure vegetarian woman, 42-year-old, and I want to ask you how I can delay aging on face, fine lines and forehead, and some dark patches on skin. So, for a vegetarian, what would you advise?
The only challenge that a vegetarian faces is about the protein intake. So, if you are very particular, make sure that every meal has good protein in it. So, if you are a South Indian, eating idlis and chutney is not the solution. Focus on your sambar. If you are a North Indian and you're eating some stuffed paratha, stuff it with the high protein stuff like sattu or paneer, or sprouts can be coarsely ground and added to your paratha, moong dal chila, besan chila. Proteins along with a lot of leafy vegetables really give you the ingredients for a good skin. So all your collagen related stuff, vitamin E, zinc, selenium, vitamin C, vitamin A will be covered if you focus on your good protein, fruits and vegetable intake. Also hydration, because women are generally poor at drinking water. I don't want to make this a common comment, but this is what out of practice we've seen. So make sure that every 1 hour you drink a glass of water, plain simple water without salt and sugar. Focus that you get good sleep, because that is going to de-stress you and will allow the skin to rejuvenate. use natural ingredients on your skin, like if you see any patches which you were mentioning, the pigment and the scars, lemon or the tomatoes are very good source of it. Basin with honey and curd is again a very good pack that you can use for your skin. Bananas are great for skin, nice ripened bananas. So natural
Yes.
ingredients to rejuvenate your skin externally, and healthy diet to rejuvenate it internally would be a good idea.
Well, Dr. Radha Shah, I think we'll have to wind up with questions. I'll have three different viewers' questions, but all of them look similar to me. You can combine all the three issues and give me an answer if possible. Judy Cutter is asking about pigmentation and dark patches. Karthik Reddy is asking about, will Zantox soft gel antioxidant capsules help skin to whiten? And also, Jahnavi is asking, 36-year-old, my skin is smooth and glowing, but I have dark circles and pigmentation. Screen time is high, sleep patterns are irregular. Any suggestions in lightening my dark skin patches?
So dark patches, we'll talk first. The dark patches, depends what is the cause. Sun would definitely be one incriminating factor, but various skin diseases can also leave behind black patches. It could be pimples or other skin issues. So we have to tackle what is the reason, primary reason for getting the dark patches. So you definitely need a consultation with the dermatologist to understand the cause. And then specifically for the pigmentation to go down, say there is no active disease, only the marks are remaining, then there are a lot of products which are there like glycolic acid, kojic acid, combined with the sunscreen in the daytime. And again, work on diet. One thing which I insist is vitamin C rich diet, especially for pigmentary issues. And the particular product that this person asked for pigmentation, I don't know what capsule he asked. I don't know what is the composition exactly, but if it is related to glutathione, I don't know the trade name that he said. So glutathione means it works as long as you take, but once you're off it, you tend to go back dark again. So that is not something I recommend in the long run. It's better to go to other simpler things and sun protection, vitamin C rich foods.
All right, thank you. So, Dr. Priyanka, we would want to wrap up today. So, one quick question that somebody wants to ask Tilak Penumaka: are sweets bad for skin?
Sweets are going to hold up a lot of fluid, add to the glycation, leave your skin really bad and wrinkled. So now the decision lies with you whether you want to have white sugar or you want to have the fruit as a source of your sweet craving, which will
All
also
right,
give you
thank you.
vitamins and minerals.
Yes. Dr. Radha, thank you so much. So, I would want some top tips. So, what are the three things that you would advise to delay aging?
So one thing I would say is the lifestyle that you live, a proper eating pattern, which I think Dr. Priyanka will elaborate more, a proper stress-free lifestyle, regular exercise, compulsory use of sunscreen, whether you're at home or you're going to work. And if required, if you have issues, you're already set in, aging process is set in, you can use creams to further postpone the process and get into procedures which we couldn't discuss much, but you could do procedures like peels, lasers, micro needling, microdermabrasion. A lot of procedures are available, varying costs, varying frequency, varying type of post procedure care. So talk to your dermatologist and understand what pattern suits you the best.
Thank you, Dr. Radha. In fact, I was expecting a lot of questions on these lasers and procedures and injections and the newer technology, but I'm surprised that people haven't asked them here. But definitely for any of those procedures, Dr. Radha Shah can be consulted on Apollo 24/7, and she'll be available in Hyderabad clinic. Well, Dr. Priyanka, I would want to know top tips from you. Three foods that one has to have and three no foods.
Okay. So three must-have foods are vitamin E rich. It could be fatty fishes. It could be on nuts and oil seeds. Every day in your diet should be included. Healthy use of the foods around that you have. Every time you eat food, you have an opportunity to feed the disease or fight the disease. And third most important message is, let your food be grown on a plant rather than manufactured in the plant. So natural versus processed is the answer for you.
Wonderful, Dr. Priyanka. And this, I must say, is one of the most informative session thus far, and very, very, very useful. These tips, I think, everybody should carry and implement in their lives. Thank you so much, ladies, for joining us this Sunday morning. Thank you, and
Thank
once
you.
again, we appreciate your time.
Thank
Thank
you.
you.
Bye. Yes, these are those wonderful tips and very informative session. Thank you for answering the questions. And actually, we should thank our audience for have asking these questions. And now it's my chance to ask you questions. I'm going to ask you 3 questions. It's going to be health quiz time. So please answer the questions over YouTube chat. Winner's name will be announced towards the end of the show. And if you are announced as a winner, please do write back to us. Your contact details should be sent to marketing@apollo247.com. Gift vouchers will be shared with you, and the winners will be selected at the sole discretion of Apollo 24/7 team. Well, here are the questions. 3 questions for today. The first question: which is the largest organ in your body? Which is actually external organ. I've given you a clue. Not the heaviest organ, the largest organ in your body. Question number 2, please state true or false. Processed meats speed up aging process. True or false? Processed meats, do they speed up the aging process? Is that true or false? Type your answer. And the last question for today, please do fill in the blank. Circle memberships save up to how much every month at an average? You can do a 50 100 rupees average here and there. Circle membership at an average save up to how much every month? This is the last question. While I wait for your answers and while the winners are being selected, let me give you the discount vouchers that you can use on Apollo 24/7. Download the app which brings the entire Apollo hospital services right to the hand. Your phone will be the one where you can utilize the entire services of Apollo hospitals. If you use this code, the code is first VC, you get direct doctor consultations at rupees 150 rupees off on the first online doctor consultation. You can use this code first VC. Let me repeat that. You get 150 rupees off on the first online doctor consultation. Use the code first VC, and this has to be used on Apollo 24/7 app. And the next coupon that we are giving away today is first 3. Note this the coupon down. First 3, you get flat 25% off on online medicine orders. Buy medicines, order medicines direct from Apollo, and also avail the discounts 25% off on Apollo 24/7. Use these both codes on to Apollo 24/7. Well, to the exclusive viewers of Health Hour who have joined us today, this is a coupon which you can use in addition to the coupons that we have given away this morning. Use the code HH247. This is exclusive for the Health Hour viewers. Get 199 rupees off on online consultation with Apollo doctors and up to 20% off on medicine orders. Well, you have heard it right. 199 rupees off on online consultation with Apollo doctors and 20% off on medicine orders as well. Please download Apollo 24/7 and use these. Of course, if you are a Circle member, you save furthermore and actually add more points, and you can buy better products as well. Well, this is today's session. Next week, we are going to come up with a very interesting topic and a very useful topic. While I'm waiting for the winners, we are going to talk about how to get relief from piles. This is something that people do not want to talk about, but you are searching for answers from experts. Do not go here and there. Do not do your own research. Do not use all these information which is out there on internet. Come to the expert straight. We are bringing you an Apollo's health expert. How to get relief from piles. Next Sunday, that is 7th of August, 11 a.m., we are going to talk about this very interesting topic. So join us next Sunday live. Well, we are waiting for the winners. I have only one winner till now, Naveen Kumar Sahu. Question number 3 के लिए आपने सही आंसर दिया है. I'm waiting for the other winners as well. Are there any other winners today? Can you please find out if there are any other winners while I'm waiting? Well, also download Apollo 24/7 app and also subscribe Apollo 24/7's YouTube channel. You can also follow us on Instagram and Facebook. There's a lot of information apart from the Health Hour, which is a weekly show that we do. There is a lot of information direct from Apollo hospitals that we do. We share on these platforms. Do follow us. If you do not want to miss any of these sessions, do subscribe. There's a bell icon there. And I think for today, it's only one of the winner. No, we do have the other winner. Harminder Kaur as well. Thank you so much. Do write back to us and claim your prizes at marketing at apollo247.com. It's Naveen Kumar Sahu and Harminder Kaur. Well, we have the other winner too. Third winner coming in at the last moment is Janvi Devi. Harminder Kaur, Janvi Devi, and Naveen Kumar Sahu, you are the winners for today's health quiz. Please write back to us and claim your prizes. Well, thank you so much. I thank the doctors and I thank the audience who have joined us today on this Sunday morning. Namaskar. Please take care of yourself.